Very common question in functional medicine is what is going on in your gut. It's very important information, and there is a test that will allow us to really look in your gut, look at the bacteria in the gut, look in your ability to digest foods, look at the inflammation in the gut, look at potentially parasites and bad bacteria in your gut. This test is called Genova diagnostic. It's a 3-day stool test. And we will go over this test, and I will show you what I'm looking for and what patients can see. So as always with Genova Diagnostic, first page is an overview, and the company gives you scores of what they think is going on in your gut. Obviously, they look at maldigestion, they look at inflammation, look at dysbiosis, they look at metabolic disbalances and infections. So initially they look at the amount of actually bacteria, how much you have in your gut. And what kind of bacteria? Is it inflammation-associated bacteria? Is it methane associated bacteria that is associated with gas formation? Also, they look at the distribution of bacteria. Is it really normal bacteria, or there is just too much of good thing or bad thing? Then they look at the amount of the bacteria on the different species, different families, and then we will go into really great details about this stool test. So initially we'll look at the digestion and malabsorption markers. We'll look how much pancreatic ellastasis you have, so how well your pancreas is working, how well your pancreas is absorbing, digesting all the foods. Then we'll look at the protein breakdowns, how well you digestion your protein. Then we'll look at the amount of fat in your stool. So if it's too much, then you're not absorbing fats really well. Then we'll look at inflammation in your gut. Then we'll look at the gut biome metabolites, or basically what feeds your cells in your gut. So if they don't have good nutrition, they're not going to be healthy, they're not going to be absorbing foods really well. Then we'll look at your actual bacteria, we'll look at the proportions of them, and we see if they have any pathological bacteria, okay? So, and if you have pathological bacteria, we'll be able to see that, and later on we'll be able to see what kind of sensitivities they have and how we can remove that. We'll also look at the strength of the bacteria in your gut. Are they strong enough to survive, to grow in a petri dish? We also look at your parasites. I mean, in this case, there are a couple parasites. Unfortunately, that actually is commonly seen in patients, and they don't know that. We also look at the other types of parasites that are a little bit more dangerous. We can see if you have a leaky gut syndrome. And then we also look at the sensitivities of that bacteria to see what we can do to remove that bacteria, pathological bacteria, from the gut. Very useful test. It's a home test. The kit contains everything that you need to have. It's a 3-day collection stool test. So you'll collect your stool for 3 days and send it to the company in order for them to analyze it.